The national vaccination program has been progressing well. As of the 31st of July 2021, 61% of our population have completed the full vaccination regimen. We are also making steady progress with our seniors. 79% of those aged 70 and above have been vaccinated with at least one dose. More seniors are coming forward to be vaccinated. Each day, about 1,000 seniors sign up for their first dose. We have to continue encouraging our seniors to get vaccinated because they are the most vulnerable to serious illnesses. More than 96,000 or 21% of seniors aged 70 and above have not booked a vaccination appointment. This is 6 percentage points higher than the general population. We will continue to reach out to as many seniors as possible and encourage them to get vaccinated. Staff and volunteers from the People's Association and the Silver Generation Office have intensified their outreach efforts through house visits and engagement dialogues. They are trained and equipped with an information kit to correct misinformation about mRNA vaccines and allay the fears of seniors. MOH has also called on all primary care providers to persuade seniors who are their regular patients to go for their COVID-19 vaccination. Our mobile vaccination teams have started to provide bed-bound and less mobile seniors with vaccinations in their homes or in the heartlands. This service has started in a few towns with a higher proportion of seniors and complements the main vaccination efforts at the vaccination centers, all of which are wheelchair accessible. Individuals who have received one dose of an mRNA vaccine, an mRNA COVID-19 vaccine, but are unable to receive the second dose due to allergic reactions have been invited to take the Sinovac coronavac vaccine. MOH has established a dedicated public health program for them to be vaccinated at a clinic in public hospitals for closer monitoring, considering their previous allergic reaction. These individuals who receive one dose of the mRNA vaccine and then complete the vaccination process with Sinovac or coronavac will be considered as fully vaccinated. This group of individuals who are allergic to the mRNA vaccines may also choose to wait for the Novavax vaccine that MOH has procured and expects to be delivered by the end of the year. MOH and HSA are working closely with Novavax to facilitate the regulatory submission for their protein subunit vaccine. The review timeline will depend on the availability and the submission of data by the company to HSA. While we recognize the need to facilitate timely access to the vaccine, there should be no compromise on the scientific rigor of the assessment of their quality, safety, and efficacy. As for the Sinovac vaccine, on the 5th of July 2021, the company submitted to HSA the critical data requested by the agency for PSAR approval. HSA is conducting a careful and thorough review of the data and aims to complete its evaluation before the end of August. The national vaccination program will cover all who make Singapore their home or who are here for an extended period of time. We are reviewing how short-term pass holders, such as those who are more vulnerable and who have been in Singapore on an extended basis due to COVID-19 travel restrictions, may receive vaccinations.
Will people who have had allergic reactions to the Pfizer or Moderna vaccine and are unable to take it, the second dose, if they get the Novavax vaccine, similar to the Sinovac vaccine, will they be able to be considered fully vaccinated? Secondly, some seniors are genuinely concerned about the safety of vaccines, possibly because of the many private messages they might have received about people suffering adverse effects after getting the jabs. Can I ask MOH if they can strive to provide more detailed information and updates in response to widely circulated reports of adverse reactions to the vaccines, so that these incidents don't get imprinted in people's minds and may lead to further hesitancy? And lastly, just a quick question. Will international students, including those studying in private schools in Singapore, be allowed to get vaccinated? And are there plans to open up the vaccines to other non-residents once there's sufficient supply, possibly at a fee?
So that's taking the analogy from what I've just described as a process where you take one dose of mRNA vaccine and then the second dose of the Sinovac coronavac vaccine. I think the first thing is we shouldn't try to second guess or jump the gun on the expert process, the professional process that needs to be undergone through our EC19 committee, We need the data submitted by Novavax. We need to study it and make sure that it meets the standards of quality, safety, and efficacy. And in principle, if it does meet those same standards, I see no reason why it shouldn't be considered in the same way as the other processes that I've just described. But I think it's premature at this point to guarantee that it will be so. We'll get the data, we'll put it through the process, and then we will announce the details later on. Mr. Giam brought up a very important point, which is that seniors can get concerned about private messages spreading vaccine misinformation or disinformation. Indeed, MOH continues to try to push back against this by putting out information, infographics. Everyone has a responsibility. It's not just MOH, but as a society, we do need to make sure that we are providing everyone, our families, our friends, our workplace contacts, reliable information and not inadvertently spreading misinformation, disinformation. We need to give them access to where they can also educate themselves and seek more information. So MOH will continue to call out false news, disinformation, put out timely facts and clarifications through the media as well as our various social media platforms. We try to maintain a sort of a central repository of this at the MOH website and at the gov.sg resources. It's about the possibility of international students, other non-residents receiving the vaccination. As I explained, we are studying how and when and the process through which people who are here for a shorter period of time can potentially get the vaccine.
What are the considerations that are given to whether STVP pass holders will eventually be eligible for the vaccine, given, after all, a lot of them are living very closely with longer-term residents or even Singaporeans and PR. So what are the reasons why they were not initially considered to be eligible for vaccinations, and what are the considerations now? And when will we expect to hear the outcome of this review?
The process is ongoing. In general, we will apply similar principles, which is around risk and whether the person is at risk in terms of COVID-19. So age is, of course, a consideration there, as well as risk to the people around them, so the settings in which they live, the circumstances in which they find themselves. So there are a variety of considerations that we take into account.